Bon matin tout le monde. Good morning everyone. It's Monday. Wow. Okay, we just had great Olympics. Alors Canada, on voit qu'on est encore en rouge aujourd'hui. Bravo à nos Olympiens et bientôt bravo à nos Paralympiens. Et je suis vraiment heureuse de vous recevoir ici dans la circonscription d'Ottawa, Vanier, Gloucester, dont je représente. Mon nom est Mona Fortier. Je suis la fière députée qui est ici aujourd'hui avec plusieurs de mes collègues. Wow! Je suis contente que vous venez par chez nous. And before we continue, I would like to acknowledge that we are gathered on the traditional territory and unceded territory of the Algonquin Anishinaabe people. Comme j'ai dit, mon nom est Mona Fortier, and I'm the Parliamentary Secretary to the Minister of Foreign Affairs and also Member of Parliament for Ottawa, Vanier, Gloucester. And joining me today are many people, as Marjorie Michel, the Minister of Health, and also Rechie Valdez, the Minister of Women and Gender Equality, Secretary of State for Small Business and Tourism, and also my friend Adam Van Koeverden, where is he? Right here, Secretary of State of Sport and Canadian Heritage. And we are also joined by Richie Bullbrook, a national athlete, and Catherine Corriveau, the Director of Policy and Advocacy at Movember Canada, behind me. Et évidemment, la sénatrice Danielle Henkel, qui est juste derrière moi, et plusieurs d'autres de mes collègues, je ne les nommerai pas tous, mais sachez que nous sommes ici représentant tous les partis du pays. Alors, c'est vraiment important qu'on soit tous ensemble ici pour l'annonce qui va être faite dans quelques instants. Et je veux tenir vraiment à remercier chaleureusement le Collège de la Cité de nous accueillir aujourd'hui. Merci beaucoup à la présidente Lynn Casimiro. Et sachez que c'est mes anciens collègues qui sont ici parce que j'ai eu le privilège de travailler ici pendant presque 7 ans et ça continue de grandir ici à la Cité. Donc, merci de nous fournir un espace pour faire cette annonce importante. Today, we are talking about the importance of men and boys' health. This announcement reflects our shared commitment to ensuring that men and boys have the support, resources, and awareness they need to live healthier and longer lives. Et pour pouvoir en parler plus longuement, j'aimerais évidemment maintenant offrir le temps à l'honorable Marjorie Michel de prendre la parole.
Merci Mona, bonjour tout le monde et merci d'être avec nous aujourd'hui. And a special thank you to Movember Canada who will work with us as an independent convening partner in this journey. I'm also joined today by my colleagues Rechie Valdez and Adam Van Koeverden. Many other of my colleagues in Parliament, thank you from the bottom of my heart. Les étudiants de la Cité et les autres invités spéciaux. Vraiment, c'est un honneur pour moi d'être si bien entourée. Je voudrais aussi particulièrement remercier Danielle Henkel, la sénatrice, qui est présente avec moi aujourd'hui et qui, elle, est en train de diriger la mise à jour de la stratégie sur la santé des femmes. Because today's announcement is really going to require a Team Canada effort. I want to begin with something simple but very important. When we talk about health in this country, we cannot leave anyone behind. And today, men and boys are at the center of the conversation. Because to build Canada strong, we need the full participation of everyone in our society. Dans les derniers mois, j'ai voyagé à travers le pays. Chaque région est confrontée à des défis distincts, mais un consensus clair s'est dégagé. La santé et la santé mentale des garçons et des hommes a besoin de notre attention. Nous ne le soutenons pas comme nous le devrions, parce qu'à vrai dire, nous ne savons pas par où commencer. Unfortunately, men and boys' health issues are too often overlooked, misunderstood, or ignored. But here what we do know. Social media use affects adolescent behavior and health with some online risks that are distinct from boys and young men. Les hommes sont moins enclins à consulter un médecin ou à demander de l'aide, même lorsque les services sont disponibles. Au Canada, les hommes sont 3 fois plus susceptibles de mourir par suicide. Ils sont plus susceptibles de développer des problèmes de jeu. 28% des hommes, 28% of men meet criteria for substance use disorder at some point of their lives. Some cancers, including liver cancer, disproportionately affect men. We need to act. Improving men's health would not only reduce suffering, but improve well-being. It would also strengthen our economy. Estimates suggest better men's health could save Canada's $12.4 billion each year. Améliorer la santé des hommes pourrait avoir un impact immense sur notre productivité dans l'ensemble des secteurs de notre économie. Nous savons également que les enfants avec des pères présents obtiennent de meilleurs résultats à l'école et ont une meilleure santé émotionnelle. Research shows that an emotionally present male partner is the single biggest predictor of a happy, healthy marriage. For those reasons, today we are launching a national conversation on men and boys' health. The input we'll gather will shape Canada's first men and boy health strategy to be released later in 2026. Starting today, Canadians can visit canada.ca/healthymen to learn more about the conversation. And beginning March 2nd, all Canadians can submit feedback through an online form on the same website. The online form will remain open until June 1st. We invite everyone to join in on this important conversation. Aujourd'hui, nous lançons une conversation nationale sur la santé des hommes et des garçons. Les commentaires que nous recueillerons serviront à élaborer la première stratégie canadienne sur la santé des hommes et des garçons qui sera publiée en 2026. À partir d'aujourd'hui, tous les Canadiens peuvent consulter le site canada.ca Hommes en santé pour en apprendre davantage. À partir du 2 mars, tous les Canadiens pourront soumettre leurs commentaires via un formulaire en ligne disponible sur le même site web. Et ils pourront le faire jusqu'au 1er juin. Nous invitons tout le monde, et particulièrement les hommes, à participer à cette importante conversation. En commençant par tous les parlementaires de tous les partis dont certains sont ici avec nous aujourd'hui. We want to hear from national and local organizations, community groups, provincial, territorial, and indigenous partners, youth, researchers, employers, unions, healthcare providers, individuals. We want perspectives from urban, rural, and remote communities, from parents who are concerned about their boys, from young men who are struggling to find their place in the society, from workers who are facing health challenges or struggling with injuries, and from Indigenous people whose experiences and solutions are unique. Cette conversation ne peut être limitée par les lignes partisanes, la géographie ou l'idéologie. Chaque voix compte. Pour réussir cette conversation et la stratégie qui en résultera, nécessiteront la coopération de tous les gouvernements, de tous les secteurs et de toutes les communautés. Il nous faudra écouter avec ouverture et empathie et dans le respect de ce qui nous sera partagé durant cet exercice. Et je suis si heureuse d'avoir un appui de nombreux autres collègues du cabinet qui auront un rôle important à jouer dans l'élaboration de cette stratégie. This includes my friend and colleague, the Minister of Women and Gender Equality, Richie, over to you.
Merci, Marjorie. Merci pour votre leadership. We can't build a healthier, safer Canada if men and boys are left out of the conversation. It's that simple. Men and boys deserve support that meets them where they are and care that they can access before challenges become a crisis. Because too often, the message men and boys hear is to tough it out, to stay quiet, and to deal with it alone. But real strength is taking care of your health, showing up for the people who count on you, and knowing when to reach out for help. When we strengthen men and boys' physical, emotional, and mental health, we're supporting healthier, stronger, and safer communities for everyone, including women and children. This is an important effort towards prevention, safety, and building the kind of Canada we all want, where everyone has a chance to thrive. Il s'agit d'un effort important en matière de prévention et de sécurité afin de bâtir le Canada que nous voulons tous, un pays où chacun a la possibilité de s'épanouir. Thank you, Minister Michel, and back to you.
Thank you, Richie. Je tiens également à reconnaître que des lacunes persistent en matière de santé des femmes. C'est pourquoi je suis très, très heureuse d'appuyer les efforts législatifs de la sénatrice Danielle Henkel visant à établir un cadre national pour la santé des femmes au Canada. Let's be clear. Improving men's health does not come at the cost of women's health. Both must progress together. Understanding how boys and men form identities, cope with stress, seek help, and relate to others is a necessary part of building communities where both men and women feel safe. In conclusion, just 2 words. Join us. Participez à cette conversation essentielle. Partagez vos expériences, votre expertise et vos idées sur le canada.ca Hommes en santé d'ici le 1er juin. Aidez-nous à élaborer une stratégie qui améliore la santé, prévient les préjudices et renforce nos communautés pour les hommes, les garçons et tous les Canadiens. Quand les hommes de notre société vont bien, notre société se porte mieux. Communities thrive when families are strong, when citizens are healthy, and when everyone feels supported. We can only build Canada strong with healthy Canadians. Thank you. C'est maintenant un immense honneur pour moi de vous présenter Richie Bullbrook. Richie, over to you. Oh, sorry.
Thank you all to everyone for having me here today and taking the time to hear my story. My name is Richie Bullbrook. I'm a Canadian national team skateboarder, and I'm training for the Los Angeles 2028 Olympic Games. I'm 22 years old, and I've been skateboarding since I was 4. This sport has been my life, as sports tend to be for professional athletes. It's a huge honor to be speaking here about the sport I love, surrounded by people shaping the direction of our country while being open and vulnerable about men's health and what it truly feels like to chase your dreams. I'm also here as a champion of the Men's Health Foundation, which helps men live healthier lives through honest conversations, and an organization I'm proud to support as someone living with my own mental health challenges. To me, there's something a little ironic about a skateboarder standing up here talking about this. Because it wasn't until recently that skateboarders were really considered athletes at all. Before skateboarding was introduced to the Olympics, I think culturally skateboarders were seen as dropouts, drug users, anything but an athlete. And I still feel that stigma sometimes. When I tell people, especially people who are a bit older, that I skateboard full time, they usually can't imagine what my day-to-day life actually looks like. They don't picture structured training environments. They don't picture strength and conditioning. They don't picture discipline, accountability, and constant evaluation. But that's my reality. I train and live just like any other high-performance athlete striving for excellence in their sport. And I hope to change how the sport of skateboarding is viewed in Canada. Now, a huge reason why I'm here today is because of my father, James Bullbrook. He was the son of a Liberal MPP, he worked in politics, he was a huge fan of John Turner, and he would have been so excited to see me here today. He put me on a skateboard when I was young, despite not being a skateboarder himself. He was my #1 supporter. He would work summers at Woodward, a training facility in the US, so I could train at one of the best facilities in the world growing up. Skateboarding was something we worked towards together my entire life. He gave me everything so I could have the best chance at living my dream. 4 years ago, I was invited to my first Olympic training camp. At the same time, my father's health was declining. Now, my father had a secret that he was ashamed of. To the outside world, he didn't drink. He turned down alcohol at social gatherings, and he told people that he didn't consume alcohol. I can only remember him seeing drink 3 times in my entire life. What I didn't know was how seriously he'd been struggling with addiction quietly for years. It ran in our family, and he knew this, so he kept it hidden. During the height of COVID, my father was hospitalized with liver cirrhosis caused by lifelong addiction. Because of the restrictions, I wasn't allowed to visit him. Near the end of his life, I found out that I had been selected for this training camp in the US, and I didn't want to go. I wanted to stay close to home. Even if I couldn't see him, I wanted to be nearby. My dad did not let me stay home. He said, "When are you going to get this chance again?" So he shipped me off and I went. And while I was at that camp, my dad was put on life support and he passed away later that day. So I'm dedicating my Olympic journey to my father and to all the men who are struggling in silence. Being a high performer... Being a high-performance athlete is one of the greatest gifts in the world. I get to skateboard for a living, and that feels surreal. But there's another side to it. Training for the Olympics is the hardest thing I've ever done. It's taken me to lows that I'd never imagined I'd experience, and to highs I've never even thought possible. Last year, I suffered the most serious concussion of my life, and for about 4 months, I didn't know if I would ever live a normal life again, let alone skateboard, and that experience taught me a lot. It nearly broke me. It forced me to confront my mental health in a very real way, and it taught me that asking for help is not optional if you want to be great and live your dreams. For many athletes, especially in my sport, an entire lifetime of work leads to about 45 seconds on the Olympic stage, and then it's over. That is a heavy weight to carry. There's a real crisis of Olympic athletes struggling with depression, identity loss, and suicide after the Games. If I didn't actively protect my mental health, I would not be standing here today. So I have a new mission, one that is inspired by my dad, but also by my own journey, because I think there is an epidemic of men being afraid to say, "I'm not okay." I am a man who struggles, and I want other men to feel like they can say that as well. I lost both my uncle and my father to alcoholism. These were preventable deaths. Silence is what makes them fatal, and we need to normalize vulnerability in men. We need to encourage uncomfortable conversations, and we need to treat mental health with the same seriousness as physical health. Being silent isn't strong, asking for help is being strong, because doing that is not what most men do, and strength is the courage to do things differently. I dedicate this journey to my dad and every man who is fighting something no one else can see. I encourage all of us to learn more, to do more, to reach out when we need it, and to be a good friend when we see people struggling around us. And finally, I want to congratulate my fellow Canadian athletes who have just competed in Italy. Take care of yourselves as you come down from this high. You've made Canada very proud. I'm really looking forward to the Summer Games and for my turn. I'm so grateful to represent the country I love and the sport I love. Thank you, everyone here today. You make me very proud to wear the maple leaf. Thank you.
Cheers, brother.
Thank you.
That was awesome.
Thank you.
Very well done.
Thank you.
Should I go back?
Mona?
Oh, c'est toi qui vas? Okay.
Wow, Richie. I need my son to meet you. My son's in volleyball. He plays with his skateboard, but it's just recreative. And he just had a concussion, so I think he'll need to talk to you because it's true. Young men are struggling with mental health, and we never know what can happen. So thank you so much for sharing your story and for being with us today. I know that you will probably leave very soon, but know that you are welcome here anytime in Ottawa, in Canada, of course, and we're very proud of you.
Thank you so much.
Merci d'être là. It's a feel-good moment this morning. Thank you. Alors, nous avons terminé notre présentation et je vais demander, est-ce que...
Movember.
Oh, Movember, OK. C'est vrai.
C'est vrai.
Mais c'était peut-être, on va vous présenter qui commence. C'est Adam. Tu vas venir parler quelques mots. Alors, mon ami Adam Van Koeverden, qui revient de l'Italie. Alors, viens, mon ami.
Thanks very much, Mona. It's nice to be in your riding, and I am in awe of Richie. That was brilliant, man. Like, your story, I think it goes without saying that the Canadian Men's Health Foundation has found themselves one of the best ambassadors and spokespeople they could have ever found. But I'm also so proud that you're a member of the Canadian Olympic team or future, and you will be, because you're going to be a great ambassador for our country. You already are. Give a round of applause for Richie, because he came here from Los Angeles to be with us today for this express purpose. He's heading down to Brazil for competition soon, and I love skateboarding. Like kayaking requires a lot of balance. So you're balancing your life, your advocacy, your passion so well. I think it goes without saying that everybody here in this room is a little more wise to why these investments, why this strategy is going to be so important. You put a real personal touch on it, Richie, and I, for one, am so grateful that you came. So thanks, man. I hope that all the men and boys that are listening today will learn from Richie's example a little bit and seek help when they need to, when they feel comfortable to talk a little bit more openly about their physical and mental health. I want to thank my colleagues, Ministers Michel and Valdez, and Parliamentary Secretary Mona for joining us today, for hosting us today, and for this really important focus. This strategy is going to go a really long way for men and boys and our entire society. I'm the Secretary of State for Sport. I was on the National Kayak team for 18 years, and it required us as an athlete commission to stand up and decide that we needed more focus on mental health within the organization of the Olympic team. And I'm really glad that the Government of Canada has invested $3.1 million into the mental health of our athletes, but also more broadly into the game plan approach, which is about career transitions and all sorts of things that Richie touched on. Because sometimes when you come home from the Olympics, it's like, everybody's had a birthday party before, right? The day after your birthday party, maybe when you're like 8 or 9 years old, you're very sad. Multiply that by 1,000 and then add on like all of the maybe regret or the hopes and the dreams that you had for many years before. So the pressure that is on our athletes, but all of our performers, really anybody that's representing Canada on the global stage, whether it's in arts, culture, academia, or sport, we need to take care of our ambassadors. And Richie, you're doing a great job telling us exactly why. So thank you very much. I know firsthand the pressure that men and boys face to seem and act tough sometimes, and that fierce competition, the pressure to win and be your very best can be overwhelming at some times. So I think it's important to recognize that below the surface, many male athletes in Canada are facing profound challenges that often go unaddressed, and that's why a strategy like this is going to go so long in making sure that we're taking care of people. According to StatsCan, more than 55% of Canadians 15 years and older are participating in sport, but my goal as the Secretary of State for Sport is to ensure that the most number of Canadians for as long as possible and as many years as possible in their lives will participate in physical activity and recreation, because we all know how good it is for our health, our mental health, the strength of our communities and our relationships. We would like to see those numbers increase, and I'm certain that a men's and boys' health strategy will help us detail exactly how and why. Nous savons tous les sports et jeux organisés peuvent avoir divers impacts positifs sur la santé mentale et physique d'une personne. Il est temps de briser le silence au Canada en ce qui concerne la santé des hommes, surtout en ce qui concerne la santé mentale, la dépendance et la sécurité publique. In a recent University of Toronto study, rates have been shown with respect to depression and anxiety to be somewhat higher amongst elite athletes, and nearly 42% of Canadian Olympic and Paralympic athletes have one or more mental disorder, including depression, anxiety, or an eating disorder. So it's important to appreciate that roughly 1.4 million athletes could be grappling with mental health issues, and that's why we're investing broadly within the athlete community alongside the Olympic and Paralympic committees to ensure that we are cultivating more care in sport across those domains for all athletes. As I said, last fall I was proud to announce an additional $3.11 million to be invested to ensure continued access for mental health services for all athletes, just like Richie, and including those who have just competed so well for Canada in Milano Cortina over in Italy, and will compete in the upcoming Paralympic Winter Games. But this also includes funding for Game Plan, and that goes to athletes who are not yet on a national team or heading over to compete for the Olympics. That approach to total athlete wellness and development throughout an athlete's high-performance sport career and beyond is a top priority for our government. Le soutien du gouvernement aux athlètes, entraîneurs et entraîneuses et au Canada est constant et indéfectible. Nous voulons nous assurer que l'équipe Canada est au meilleur de sa forme physique, mentale et émotionnelle. And with the start of this important strategy, we can get the conversation started to help more male athletes from coast to coast to coast. So I want to thank everybody here today, all of the advocates, the scientists, the researchers, the physicians, and the parents. I could tell, Ms. Bullbrook, how proud of your son you were today, and I think it goes without saying that we all are. So thank you very much, everybody. Merci pour votre leadership, Ministre, Madame la Ministre. And now I'd like to invite my friend, and the Director of Policy and Advocacy for the Movember Foundation, Catherine Corriveau, to say a few words. Thanks, everyone.
Merci, Madame la Ministre, pour votre leadership qui nous a menés à ce moment ici. My name is Catherine Corriveau, and I'm the Director of Policy and Advocacy at Movember Canada. For more than 20 years, Movember has worked very hard to change the face of men's health. We've funded research and life-changing and life-saving programs. We've worked in communities, workplaces, sport, in schools, in skilled trade sectors. We've partnered with clinicians, researchers, and frontline organizations across the country and across the globe, many of which are in this room today. But Movember is not just an organization. It's millions of individuals. Ce sont les enseignants qui se laissent pousser la moustache avec leurs élèves, les équipes de construction qui se lancent des défis et entament des conversations courageuses, les coureurs qui accumulent des centaines de kilomètres en mémoire d'un ami, the workplaces having their first honest conversation about mental health because someone decided to sign up for Movember. Every year, millions of people participate in Movember globally, but they're not policy experts. They're fathers, brothers, sons, partners, and friends. Many of you are in the room today. And they show up because this issue is personal. Our job is to carry their stories in rooms like this. And for over 20 years, we've seen the same pattern repeat itself. Too many men are dying too young. Too many are struggling in silence and only reaching services when they're already in crisis. At Movember, we often talk about meeting men where they are. Not where we wish they were, where they actually are. Ça signifie dans les arénas de hockey, sur les chantiers, dans les programmes de métiers spécialisés, chez les barbiers, dans les communautés de jeux en ligne, dans les petites villes rurales, dans les grands centres urbains. It also means being willing to have a difficult conversation about loneliness and the cultural expectations that shape how men think about vulnerability and help seeking, about identity, and what it means to be a man in 2026, about fatherhood and family, about digital spaces from AI companions to influencers to porn to online dating. Movember has never shied away from those conversations. We actually lean into them. We make them real and accessible, and we connect them to hard evidence. Because if we want systems to change, we must understand the lived reality behind the statistics. This strategy and this work by Minister Michel matters to Movember for 3 reasons. First, it signals that men's health is not a niche issue. It's a national one. it intersects with workforce participation, economic resilience, community stability, and family well-being. The alignment across these portfolios is essential. Deuxièmement, ça confère une légitimité à la prévention. Trop souvent, les systèmes sont conçus pour intervenir en moment de crise. Une stratégie nous permet de mettre l'accent sur le dépistage précoce, l'intervention en amont et la prévention. Elle nous amène à réfléchir à la manière de concevoir des services que les hommes utiliseront vraiment, pas juste des services qui existent. And third, it reflects the voices of millions who already believe this matters. The people who fundraise, advocate, and share their stories every November are asking for something bigger than awareness. They're asking for coordination and systems that work. Because the truth is, poor men's health impacts us all. If you've ever had to take time off work to care for a sick loved one, if you've lost someone to overdose or suicide, if you've seen a friend withdraw into isolation, you already know that men's health is not just a men's issue, it's a public health issue. Cet exercice de mobilisation est l'occasion de rassembler celles et ceux qui connaissent déjà les lacunes, de mettre en lumière les innovations qui émergent discrètement dans les communautés partout au Canada, de créer des liens entre chercheurs et praticiens de première ligne, de remettre en question les hypothèses avant qu'elles ne deviennent des politiques publiques et de faire en sorte que l'expérience vécue ne soit pas une réflexion d'après-coup, mais vraiment le fondement de nos politiques publiques. Our role at Movember is to ensure the policy is informed by strong evidence, practical insights, and the voices of those closest to the work. And it's to ask the hard questions. Canada has a unique opportunity right now to rethink its priorities. A public conversation can be about resilience, participation, and national strength. You cannot build a stronger Canada if a significant portion of your population is disengaged from their health. You cannot strengthen families if fathers and sons are not supported. You cannot build economic resilience if a large segment of the workforce is struggling silently. When men's health improves, communities strengthen, families stabilize, and systems ease. This is about completing the picture of health in Canada. Movember is proud to step up as an independent partner in this work, as we have with governments across the world, because we have seen what is possible when prevention is prioritized, when stigma is challenged, and when systems are designed with men in mind. We're ready for change, and so are millions of Canadians. Le moment est venu de bâtir quelque chose de coordonné, crédible et durable. Merci de nous donner l'occasion de contribuer à ce prochain chapitre. We're very excited, but more importantly, we're ready to get to work. Merci.
Merci, Catherine, pour cette intervention. And know that even November is in a couple of months, so I'm challenging you all to invite at least 5 people to participate to the next Movember, which is in a couple of months. So you have plenty of time to get ready. Because some of you, I'm sure, have participated already. I know I've given money to some of my friends, so let's do that together. Alors, un grand merci encore une fois à tous ceux et celles qui ont pris la parole aujourd'hui. C'est un mouvement, comme la ministre Michel a dit, join us, joignez-nous à cette importante conversation qui doit se faire tous les jours, évidemment. Et je suis certaine qu'à votre repas ce soir à la maison, vous allez parler de cette question qu'on vous pose aujourd'hui. Alors, merci beaucoup d'avoir été là pour cette annonce. Je vais inviter la personne qui lève la main, que je ne peux pas voir, mais qui va gérer la période de questions, parce que vous savez, quand on fait des annonces, il y a toujours une période de questions. And now is the question period, and I invite my friend to invite the journalists to ask questions.
Merci, Madame la députée. Je ne crois pas qu'on a des questions dans la salle, à moins que je me trompe. Non, donc on va passer directement aux questions en ligne. On a quelques journalistes en ligne.
Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Veuillez aussi m'indiquer votre nom dans le Zoom pour indiquer votre nom et votre média. We'll now proceed to questions from journalists online on Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Please modify your Zoom handle to reflect your name and your media outlet. Our first reporter, Christy Kirkup. Go ahead, Christy.
Hello, thanks very much for taking my question. My first question will actually be for Richie. I'm wondering if you can just speak to, sorry, not the minister, sorry, the skateboarder. I apologize, Minister. What do you think your dad would think of the fact that you're speaking publicly not only about his own struggles but about yours at this time?
I don't know, but I like to think he'd understand why I'm speaking about it, because I think, you know, men are afraid to talk about their struggles, especially with addiction. So he would get over it, but at the beginning, I don't know if he would like it, but he would understand the importance of it, and the platform I've been given to speak about it, I think, is an excuse. And with regards to my dad, what he'd think of me being here, I think about that a lot. I wish he could see a lot of the stuff I do. I mean, he'd be proud. I just don't know to what extent. Like, 'cause I think he'd be shocked at how far I got. Like, he'd be like, "Wow, what?" I don't know. It's just. I'm very lucky, so I think he'd be shocked, and I would love to see what he had to say. But does that answer your question? I'm sorry.
Yeah. Yes, thank you so much. And thank you. And just for my follow-up question, this will be for Mr. Michel. I'm wondering if you could speak to how the manosphere and online trends in this regard are having an effect on men's mental health.
Well, as you know, we have many factors, including this one. But what I want to say about this consultation, it's an open conversation. So I don't want to preempt what I will find in those consultation, because this is why we are doing the conversation. We need to hear from people. So of course we know, you know, that social media, we read a number of studies about it, but what is impacting our men and boys here in Canada, I think we will gather information during the consultation. Did I answer your question?
Merci, Madame.
D'accord.
The second reporter that we have is going to be Sarah Rechie from the Canadian Press. Go ahead, Sarah.
The question is also for Minister Michel. I'm hoping you can just explain why the Canadian government feels that it needs to do this now. So why now, and why a men's health strategy?
Okay, so, you know, I'm the Minister of Health and Mental Health. And as I said in my speech, when I started touring across the country, my first trips in June 2025, every province where I landed, people were raising challenges with men and boys and the fact that they are struggling. But it was in every single trip. When I met organizations, when I met governments. So what I did in October, because it was not part of my provincial and territorial meeting with the ministers, but I told them at the end, you know, I am very preoccupied because this is what I grabbed from the ground. People always talking about men, health, and boys. And I am a minister of health, and, you know, I have to take care of the whole population, so I don't want to leave anyone aside. And I have to say, it was a very strong moment in that federal, provincial, and territorial meeting. And this is where we all agreed that we have the same concerns. So I said, okay, but if we have the concern, we need to deal with it. So this is when I started to have, talk with people, organization, and then I went to the Movember activity in November, and this is where I said, okay, now we need to move, and we need at least to, I don't know where we'll land, I don't have any commitment on budget, but at least that's the first step, let's go with that. And as you can see, I have a big number, not all my colleagues could be there today, but we have very strong support and from every single, party. So I feel it's everybody feels the need, and I think that's my responsibility.
And to follow up, Minister, one of the things that strikes me is that we have pretty good data, in particular from Movember and other groups, about what the problems are in terms of preventable diseases, that kind of thing. What are you going to do in the meantime as the Minister of Health to start tackling those problems that are under your purview that we already know exist before getting to the end of a strategy?
Well, first, I would say we are launching consultation until June. Then we will gather all the information to launch the strategy. As you said, Movember and others are bringing a lot of, data already on some policy decision that we could take. But I think most importantly for us is what people would like us to prioritize. Because we have a lot of chantier, but we need to go step by step. And I need people, men particularly, to let us know, okay, this is the plan, this is what is so important for us to deal with right now. And then we have a second step, and a third step. So I feel going through those conversations will help us prioritize, because we do need to prioritize.
Merci, Madame Michel. We don't have any more questions on the Zoom, so that concludes our event for today. Thank you very much, everyone.
Merci beaucoup tout le monde, and I just want to say hello to Madame Bullbrook also. Nice to see you here today, and hope we can get a picture with your son. It would be great to have you on stage. Thank you.
Et vraiment, merci beaucoup à toutes les personnes qui sont dans la salle, qui se sont déplacées aujourd'hui pour l'événement. Merci beaucoup.